Hello viewers, this is going to be a nice interview and I am being in conversation right now with Pune Times Mirror. I think it's very crucial to know that the overall spectrum of cardiac problems in India is drastically changing. And since the time I started my practice here, and we have been hearing for a very long period of time, in fact, it was in 1988, the first time the Indian Council of Medical Research published a data based on epidemiological studies that India is going to be the hub. India is going to be the premier place. India is going to be the capital of diabetes and heart diseases. And we have actually witnessed that kind of a serious growth in all these comorbidities which contribute to these problems, which include obesity, stress, inactivity, bad lifestyle, increased incidence of smoking, abuse of substances, etc. So your question is very valid, that we are seeing a sea change in the type of cardiac diseases that we are seeing and a big change in the age group in which it is affecting. We see a lot of youngsters. In fact, you'll be surprised that 2% of my patients are below the age of 30 years who have unstable anginas, heart attacks, diabetes onset, etc. So that's a very valid question. I think when you touched base with the fact that we have lost a lot of young people, a lot of young celebrities, I think Puneet Rajkumar, Srivastav, we have had KK, a great singer whom we have just lost at a very young age. And a couple of these deaths have occurred especially after strenuous physical activity in the gymnasiums. So issue is always raised whether this kind of an activity, which is very physical, which is very aggressive, which is very vigorous, can make an impact on your mortality. I think one must understand that whenever you undertake a physical activity, you must find out whether you are fit enough to undertake that kind of an activity or not. Unfortunately, what happens is, for Gen Z, fitness, looking good is very crucial. I will always say one thing very important to all of you, that it is not just the external fitness which matters. It is the internal fitness which is very crucial. And when I talk about internal fitness, it is about your blood pressure, it is about your heart rate, it is about how your vascular health is and whether your comorbidities are at bay or not. Now, when we focus on the external fitness, you tend to embark upon a physical activity or a dietetic regime or even a very vigorous level of gymnasium activity. Now, a lot of these people who have actually had mortality after gymnasium workouts have probably had some kind of an underlying heart issues which have never been diagnosed. And when I say that, they are not necessarily the blocks involving the heart arteries, but they can be cardiomyopathies, they can be various arrhythmias. Now when I say cardiomyopathies, it is the disorder of the heart muscle which makes you prone for sudden cardiac death. And therefore, whenever you embark upon physical activity which is very strenuous, you must make sure that you are physically fit to undertake these. And for this, you need to consult an appropriate doctor, make provision for certain tests, and then only embark upon these activities. Charity begins at home, and unless and until you talk about these particular issues more openly, I can tell you an example. Dating back to about 23 or 24 years when I started my practice in India, people were unaware of good cholesterol, bad cholesterol. They did not know exactly what is the normal blood pressure. But today, people are more aware. They know that the normal blood pressure is 120/80. And there is something called as good cholesterol. There is something called as bad cholesterol. People have understood the bad effects of smoking. The incidence of overall smoking is probably on the decline. I still remember there were movies long back where you would see hero or let's say a villain in the movie smoking in public places. There was a time when people used to smoke in restaurants, in theaters, but gone are those days. So we are becoming more conscious, we are becoming more aware, but as you rightly pointed out, this has to be talked more openly, discussed in private, discussed amongst the family members, so people understand what is cardiovascular health and they are more aware. Your first question was whether the infrastructure is good enough. So when I started my practice once again many years back, there was a difference in the Western world and Indian infrastructure of close to 10 to 15 years. Today, that difference has narrowed down to probably 2 or 3 years, which means we are definitely on the progress path. Government has done enough to create government infrastructure, make a lot of facilities available, but of course, here I would think that the private sector scores much more over the government sector, and such facilities are probably not so much available in the government sector, but I am sure with the overall stability of the government, with the overall inclination of the government towards addressing these issues, we will not be far from reality when we will probably be able to impart world-class medical facilities to even at the lowest of socio-economical rung. When you said that India is the capital of diabetes, it is very true, and there are multiple factors which are responsible for this. There is something called as Indian paradox, which means it is important to know that the Indian food, the Indian lifestyle, the aggressiveness of our physical involvement, doing exercises, involvement in the sporting activities is lesser as compared to people in the West. In fact, those playgrounds which used to be very, very commonplace during our young days, they have completely disappeared. Students and young generation are struggling to find places where they can exercise, where they can play and be involved in the sporting activities. So inactivity in Indians is a major contributory factor. So is the diet. I'm not going to elaborate about the diet, but we know that we tend to eat lesser proteins and consume more carbs, which may be deleterious and which can contribute to the onset of diabetes. Stress definitely contributes. India is evolving. It's one of the most progressing nation in the whole world. And the progress of a nation does not occur just like that. Somebody has to make a contribution. Somebody has to struggle. And it is probably the younger generation who is striving very hard, who is working very hard. There are many examples where younger generation are involved in their professional activity from 8 a.m. until 9 p.m. They hardly get any time for their dietetic planning. They get no time for exercising, and they depend a lot on junk food. I think these are the predominant kind of contributory factors towards causation of diabetes in Indians. I was telling you about the Indian paradox. It was seen that people from India who migrated to US and Canada, it would be believed that they would probably be lesser prone for diabetes. But no. Even when Indians migrated to Canada and lived there for 20, 30, 40 years, they were still more prone as compared to other people in Canada or US for diabetes. So there is something which is probably genetic, which is very specific to Indians, which makes them prone for development of diabetes. Another contributory reason for development of premature diabetes in women is also polycystic ovarian problems. My endocrinologist colleagues see a lot of these patients nowadays. It may not make an impact directly on diabetes, but it is a syndrome, it is a complex which exists together, and by way of increased visceral adiposity, which means increased abdominal girth, these women are more prone to development of diabetes and hypertension. So these are, in nutshell, some of the important reasons why Indians are prone for diabetes. Latest developments in cardiology have been on various forefronts. Let us talk about coronary artery disease, which is the development of blockage in the heart arteries. We have better diagnostic options. We have better therapeutic options for coronary artery disease. We have better stents. We have a lot of gadgets that deal with the thrombus or the presence of a clot in the coronary artery. Let us talk about valvular heart disease, where we are now able to replace the entire heart valve without a single stitch or without a smallest cut on the body. This is called as transcatheter aortic valve replacement, in which case we replace the entire aortic valve by way of a small catheter. In fact, the patient is not even given the general anesthesia, and it is completely accomplished under local anesthesia. The patient can ambulate within 12 hours and is probably discharged in 24 hours. Likewise, replacement of the mitral valve is also possible through the catheter. Now, there have been various interventional procedures like arrhythmia ablations, which are advanced. Certain devices which are implanted to prevent sudden cardiac deaths. These are called as implantable devices, which we have been practicing for almost last 5 to 10 years. There have been advances in diagnostics. Nowadays we have wearable devices which will let you ambulate, which will let you do all your activities and keep on monitoring your pulse, blood pressure, respiration, blood pressure, saturations, and give you a very worthwhile data which will contribute towards making a definitive diagnosis. There are certain patch diagnostics, which means by way of just putting in a small patch, you can probably come to know your blood sugar over 24 hours, maybe weeks or even months. And that helps you to monitor your blood sugar and manage your diabetes very well. There are AI-based diagnostic algorithms available in CT scan, MRI, various modalities for cancer management, etc. So I think there have been a humongous progress in not only just cardiology, but all other fields, and I think the medicine is going to change very drastically. It is going to be more available for everyone, and it is going to be at fingertips. Having asked that question, I must tell you one very, very important thing. There is something called as urbanization of rural India. Now this urbanization is nothing but migration of people from rural areas or smaller places to bigger places in search of jobs, in search of better quality of life. And in this process, they are exposed to stress, they are exposed to not so healthy living conditions. They are exposed to a lot of pollution, which is a part and parcel of metropolis. And urbanization, which was 5% about 50 years back, has gone up to 35%, which means 35% of the population every year is migrating to bigger cities for these things. Now, to cater to rural population, I would only strongly recommend that we pay our taxes on time, we make sure that we do our bit very rightly, so that more funds and finances are available to the government for managing rural health as well. Thank you.